Hey y'all, how's it going? So we're going to be talking about normal sinus rhythm with PVCs, or premature ventricular contractions. Okay? The best way to see this is these crazy ass things right here. I think all of us in class, as soon as we saw this, were like, oh, that patient's dead. Actually, it's not as bad as you seem. The patient may experience some mild discomfort in the chest, but nothing too insane. Okay? So, here's the biggest way to see the difference between a PAC and a PVC. Now, PVC, which is what we're looking at right here, doesn't have P wave. There's no P wave here, and it's a different QRS complex. So PAC, or the premature atrial contraction, will have a funky P wave and a normal QRS, whereas a PVC looks like this patient just had the shock of a lifetime, pretty much, but it's just a normal thing that can happen sometimes in the heart. It can be due to oxygen issues. I've seen a lot of patients with COPD that end up with these. It can be very benign. I know, I think one of the professors mentioned that they have PVCs the other day. It's just a part of someone's heart sometimes. The issue is when you start seeing these more frequently. So once we start seeing a couple of these a minute, you want to start slowing down a little bit, asking, hey, has anyone ever noticed this for you? And they'll say yes or no, or it depends. A lot of cardiac patients know a lot of their cardiac history, so just ask them and see. But PVCs, this one right here, so it's going to be a crazy wave. It can be like this, it can be inverted like this one right here. It'll be normal sinus, and then all of a sudden you'll just be poof, and it's like out of nowhere. It just doesn't make any sense. Sometimes it can be rhythmic, so this would make it the rhythm. It's regular, but except for the PVC, so I would say this is normal sinus rhythm with one PVC, whereas this one's normal sinus rhythm with two PVCs. If there was a PVC, say right over here, this would be called ventricular trigeminy. So it depends on the rhythm, but for now, all you need to know is this is what a PVC looks like. When you see it in the exam, just make sure you point that out, okay? If you have any questions, please let me know.